Narrate your care. People can hear you when they're unresponsive.
Love that stitch from Penny. Loved the original video. Make sure you go back and watch both. I have a story about this. Back when I was an ICU nurse, I had lots of patients who were intubated, meaning breathing tube in the windpipe, and sedated, asleep. We worked in pods, which were clusters of ICU rooms together. And as nurses, we would go in to help each other with turns and patient care. One day, I was in a pod with a nurse who was taking care of a patient who was on ECMO, and he was intubated and sedated for a really long time. And she had a really funny story that day about how the day before she went ice skating and fell on her butt, and how her butt was still really sore and she was limping around the unit that day. The story was really funny and absurd how it happened. She probably told every single one of us at least one time that day, and each time in the patient's room. Both of us were back at work a second shift in a row the next day, and it happened to be the day that that patient's sedation was turned off and he was extubated, meaning breathing tube was out and he was awake. I swear to God, the first thing that came out of his mouth was, "Hey Mary, how's your butt?" We were cracking up. It just goes to show you that yes, even if your patient is asleep, unconscious, family member, it is still worth talking to them. And if you are a healthcare provider, yes, please continue to narrate your care.